I'm Jo Baxter, Policy Officer at Alzheimer Society. This presentation will look at an Alzheimer Society discussion paper, A Future for Personalised Care, which we published earlier this year. Prior to the COVID pandemic, decades of underfunding and neglect had led to a social care system where people were struggling to access the care they need. The pandemic exacerbated the issues as well as presenting new ones. However, the pandemic has also brought social care into the spotlight in the media, leading to greater public understanding of the issues. The urgency of the need for action, coupled with this improved public understanding, has led to a growing momentum for calls for reform rather than returning to the status quo pre-COVID. Reform presents an important opportunity to ask what the vision of social care should be in order to meet the needs of people with dementia who draw on care. We explored this question in our discussion paper. We reviewed evidence from policy literature, from legislation, guidance, standards and frameworks that define quality care or drive improvement from leading bodies across the social care sector, as well as evidence from research hubs such as the Alzheimer Society Centres of Excellence. In our evidence review, personalised care stood out as key to quality of care for people with dementia. If we look at how social care functions now, it's mostly about delivering personal care. This is supporting people with tasks such as washing and dressing. This support is vital, but this type of support alone will not necessarily help someone to live well, which everyone should have the right to. By contrast, personalised care involves choice and control for the person drawing on care, including choosing goals that are most important to them that they want help with achieving. Care should help people with the things that give their lives meaning and purpose. This will be different for everybody and is why a personalised approach is key. There's growing support for a vision of personalised care from leading bodies across the sector. Another theme that came across strongly in our review as a key factor in good quality care is relationships. Research, as well as the pandemic, has highlighted the importance of this. The restrictions of care home visits show just how important contact with family members and other loved ones is to the health and well-being of people with dementia. The impact of the lack of this contact has been linked to deterioration in the condition, worsening symptoms, and possibly even deaths. An Alzheimer Society inquiry found that 79% of 128 care home managers surveyed reported a lack of social contact was causing deterioration in the health and well-being of their residents with dementia. We must ensure that lessons are learned from the pandemic about just how vital meaningful contact with loved ones is. Social connections, supporting people to build or strengthen relationships with loved ones, family members, or people in the community must be fundamental to care. Our discussion paper made a set of recommendations. Firstly, social care needs funding to stabilise the system and then to invest in the changes that are needed to facilitate a move to personalised care. Good quality care starts with staff working in care having the necessary skills and knowledge. Care workers need an understanding of personalised care, what this means and how they can deliver it. Care workers also need an appropriate level of understanding of dementia, what it is and how it affects someone, and how best they can meet the person's needs. Ongoing learning is also essential. Beyond training, care staff need to be valued for the work that they do and have their own well-being supported in order to enable them to support others' well-being. Career progression, a culture of respect, good leadership, and appropriate pay are basic principles that help create a working environment which is better for care staff and better for the people they support. Reform for quality care can't happen without reform for the workforce. There are also huge numbers of staff vacancies facing the sector, and these workforce changes are also needed to help the sector attract and retain staff. We now need to ensure that momentum is maintained and reform is delivered for the creation of a social care system that delivers the care that people with dementia want and need, and the care that we would all want to see for ourselves and for our loved ones.